Hello, I'm Dr. George Ampat. I'm a consultant orthopedic surgeon. I work in Liverpool in United Kingdom. I'm going to explain a little bit on gait and how gait can be analyzed. I'm not going to do a detailed analysis, but simple steps in the gait analysis which may be relevant and which can pick up appropriate pathology in the lower limbs or neurological deficits. So I'm going to ask Angela to walk towards me and walk backwards, and then I will ask Angela to do in the slow motion, and I will also see whether we can demonstrate a little bit of running so that I can differentiate to you what's the difference between walking, running, and how we can analyze the different parts of the gait cycle. So Angela, I would like you to walk towards me in a normal pace as you would normally walk, looking straight ahead, come up to here, turn around and walk back, please. Turn around and walk to the end. Thank you. So we saw Angela walk and we were looking at the rate at which she was walking, whether the rhythm was the same, and also whether there was any asymmetry between the left and the right. But the most important is to analyze the gait cycle, and let me explain what the gait cycle is, and for that I'll ask Angela to walk in slow motion and explain what the gait cycle is. There is a swing phase and a stance phase. So as she is standing, both the legs are in stance phase, they are not moving at all. So Angela, I want you to do a slow walk, lift your right leg and push it forward. So now the right leg is in swing phase, and can you land your right leg? So now the right leg has started the stance phase and the left leg is going into the swing phase. Come forward, the left leg has started the stance phase and now the right leg is starting the swing phase. It alternates and comes forward. So there is a stance phase and a swing phase, and this is important to recognize. Can you do that same? So the swing on the left, stance on the right, double stance now, and right is swing, double stance, left is swing, and there is a double stance, right is swing, and there is a double stance. Back to normal. So what we see in walking is that there is a double stance. There is one point where both the feet are on the floor. That is the principal difference between walking and running. I don't know whether we have enough distance for us to show how someone can run, but I will see whether we can try to demonstrate it. I want you to now run towards me and run back. I know it's difficult, not a fast walk, a run. I know the distance is short, but let's see whether we can do that. Can you run towards me? Good, and turn around. Brilliant. So what we notice here is there is a moment when both the feet are away from the floor. So instead of a double stance which is there in walking, there is a double swing. So that is biomechanically the difference between walking and running. So fast walking is not running. Someone could walk fast and beat someone else who is running. But running is when both the feet are away from the floor for a momentary period, there is a double swing. Now, one of the most important factors in gait when they have pathology is to see whether they have antalgic gait or painful gait. So let me demonstrate how an antalgic gait is. We saw when Angela was walking, the swing phase on both the sides and the stance phase on both the sides were equal. That is, as she was walking, the stance phase on the left and the stance phase on the right was similar. But what happens when you have pain? Say if I have arthritis in my left hip, then I don't want to put my left leg on the floor, or I want to decrease the amount of time I'm putting the left leg on the floor. So that is when you have antalgic gait, and technically the definition of antalgic gait is when the stance phase is decreased. So let me show how I'm walking with a limp, and that will demonstrate a limp is an antalgic gait. So what you noticed is when I am swinging my right leg, I'm doing it quickly because I want to reduce the stance phase on this leg. I don't want this leg on the floor too much because that hip is the painful hip. Whereas when I swing this leg, I'm taking my good time to swing it, or the normal time. But when this leg is taking the weight, I want to decrease the period and I swing the opposite leg quickly. That is an antalgic gait. So when the stance phase on one particular leg is decreased, and the swing phase is or decrease on the other leg, that is what you call as an antalgic gait, or where there is pain in a hip or in the knee because weight bearing through that joint is increasing the pain. So that is an antalgic gait. The next type of gait you may find is a high steppage gait. A high steppage gait may be from weakness of the muscle. So sometimes there may be a foot drop and the foot does not clear the floor. So normally as we are swinging, the foot is lifted off and you land on your heel. But sometimes because of a neurological deficit or a foot drop, you are not able to lift your foot off, and instead you have to then clear the floor by lifting your leg up because you have a foot drop, and that is a high steppage gait. The third type of gait is an unsteady gait because of myelopathy. Myelopathy is when maybe or because of an upper motor neuron problem, your nerves to your brain are not connected well and there is a lack of balance. In a lack of balance, you would have a wide steppage gait. So you may walk as if you are inebriated with alcohol. You are walking like this. But this is not because someone has alcohol in them, but because they are losing balance and they are widening the width of or the legs between their legs so that they can get greater stability to improve their balance. So those are the main points, and the main gait that we need to understand is the gait of antalgic gait when there is pain in the hip or the knee. So that brings us to the end of the short talk on gait analysis and while examining a patient.